All right. Good day, everyone, and welcome to Westchester County Facebook Live. Our continuing conversations during the coronavirus pandemic, and as we start to unpause, and we hope to hit our metrics as the 7 metrics that are necessary for the county to open. Today, we are on May 20th, we are at 5 out of 7. We're going to keep our fingers crossed as we continue to work through different things. But today we are especially proud to have the dean of our state delegation, a good friend of mine and a person that has been a leader in so many different ways. He's got that quiet leadership that a lot of people don't realize how much work that Assemblyman James Gary Pretlow has done. But I will tell you, when I get the opportunity to go up to Albany and see his colleagues and understand the way that he has worked, his partnership with Speaker Hasty and all of his colleagues up in Albany is tremendous. And we are privileged to have with us today Assemblyman James Gary Pretlow. Good morning, Assemblyman.
Good morning, Mr. Deputy County Executive Ken Jenkins. How are you today?
I'm doing wonderful, and which I hope trust you and your family are doing well during this pandemic. And the colleagues certainly, you had some colleagues initially that were diagnosed with coronavirus, and that caused the whole stir up there in Albany,
Yes.
Cleaning, etc. So I hope everyone is doing well. I trust everyone in your family is doing fine. And again,
well, thank God everyone in my family is doing fine. As many of us have lost a lot of friends and acquaintances, but we're getting through this, and hopefully a vaccine is found, or a cure, or something to stem this, because we of a certain age have been staying indoors as much as possible. I'm doing this from home now. I've not been to the office except for emergency situations since the beginning of April. Because I can do a lot of it from home, and staff is working from home, and thank goodness for things like Facebook Live and Zoom and the Skype and all these new fandangled things that I was never very, very good at, but I'm getting better now, so we're working.
Well, first, Assemblyman, first, thank you again for taking some time to talk with us, and all of our audience that is watching from around the country. I mean, the Facebook Live for Westchester County, because we started with the pandemic. We had the first containment area in the country, in New Rochelle, and then we certainly have developed so many things. As the Assemblyman that represents Mount Vernon and Yonkers, we're going to talk some things specifically about your district and the kind of challenges that may be in district. But let's talk about your role as an Assemblyman. As you said, you've been working remotely and taking care of those things. I know that you're on a call with the state every day, and people for those state benefits have been pounding your office about trying to make sure that they're getting unemployment benefits, making sure that they're not being inappropriately evicted, and all types of things that have been happening. So how has your role changed, Assemblyman, during the pandemic?
Well, now it's more for advocacy than legislation. We have not been in session since we passed the budget, in session as a body to pass laws. But right now what I'm doing is really representing, to the best of my ability, the constituents that are having issues because of the pandemic. As you mentioned a little earlier, unemployment is the biggest obstacle. New York State went more than 3 million cases in the first week and a half, which is, we weren't ready for that. The state was not ready for it. So a lot of things were backlogged, but I'm pretty sure now we're catching up, and now it's just the outlying issues that have to be taken care of. Billions have been paid out in unemployment. I know the PPU and the PPI and all of those alphabet soup things have been going out, and we're just trying to make sure that people do get the benefits that they deserve. I just ran into another problem yesterday, and a young lady who has finally got through to unemployment, and she's communicating through a cell phone, and it seems that Boost Mobile is not giving people any leeway in their bill. So they turned off her phone. Now she can't contact unemployment. They can't contact her. And now we're trying to work out some way to be an intermediary to make sure that this young lady gets her benefits and gets her phone turned back on. But these are the kind of things that just crop up that we work on.
And you know something, Assemblyman, one of the real things is that your office and every elected official's office always has a constituency outreach group and handling issues. But as you just mentioned, your office has basically turned into a clearinghouse for almost all of those kind of issues now, that you don't divide the legislative time up. Because a lot of times, again, people do not get to see you doing the work that you have to do in Albany. They just know that you're in Albany for a couple of days, and then you come back and you have your constituent services and your great team of individuals that are out of both your Yonkers and Mount Vernon offices to make sure things are happening. But you talked about one kind of scenario with utilities where there's a bunch of things that were done by the governor, and you all had in the budget process given the governor a great amount of authority to do different things. From your perspective, from a legislative perspective, and from a representative for the people of Mount Vernon and Yonkers, and that kind of advocacy, has that been able to help? Because, you know, for those folks that have had unemployment issues, they call your office, and you all have been able to work directly with the governor's folks on different things.
Yes, well, in anticipation of the pandemic widening, before we left Albany as part of the budget process, we gave the governor a lot of authority to make decisions. We trusted the governor to make the right decisions because, quite frankly, everything that he did an executive order on would normally have required a separate piece of legislation, which means that we would have to have been traveling back and forth to Albany to vote on every one of those executive orders. But we did give him in advance the authority to do all of that. So we would hope, and I'm pretty sure he has, operated in the best interest of the individual citizens of the state of New York. So that was why we did that. Some people in my conference weren't happy. They said that we were basically making the governor king, and I think cooler heads prevailed, and we showed those naysayers that this was the right thing to do, to give the governor the undaunted power to make decisions on behalf of all the residents and citizens of the state of New York for the better good.
All right, and again, as in your leadership role, I know that you are one of the cooler heads in a conference that may have folks that in it that are challenging. And I'm not talking about our local conference, obviously. I'm talking about the assembly people around the entire state because they have different thoughts. Our Westchester delegation is a tight delegation, and again, because you lead that delegation, it's been a privilege for us to work with you to make sure that things get done. So from your role, what do you think are the specific concerns in Westchester that you see that you in your role as the delegation leader in the state legislature can be helpful in? What do you think are the biggest concerns?
I think the goals in Westchester are the goals everywhere to find a cure for this and get business back to normal. We have thousands of individuals who are now unemployed, even though there are no evictions until August. August is right around the corner, and there's going to have to be some way for these people to get money. I found out maybe 3 weeks ago that several companies are playing games now with unemployment. To get unemployment, to qualify for unemployment, you have to have been terminated from your position. What some businesses have been doing is lowering employees' hours to zero. So they have no pay coming in, but they're not terminated. They're still technically employed by the company. Their hours are zero, so no money is coming in, and they're having a hard time getting unemployment. And the same thing with furloughed individuals. People who've been furloughed aren't in many cases um, qualifying for unemployment, yet their bills are still coming in and they're not being paid by the employer. So right now I'm working on something to make sure that anyone who is not receiving an income should receive some benefits from the state of New York.
And that's an important point because again, I know that that's basically the people are calling off the hook and they're emailing and they're not seeing you in the street, but you know, whatever ways they can get it to you, they're letting you know that they are in desperate scenarios and they're trying to be able to apply for benefits. And again, as you said, Assemblyman, no one was prepared for this. I remember hearing in one of the governor's press conferences almost something, as you said, 3 million claims when the normal amount of claims was somewhere in the 50,000 range in a
Right.
week.
That was more than a year's number of claims, and it came in a week, and
Right.
you know the staff just wasn't set up for it.
Yeah, the staff, the system, anything that was done.
Right.
So again, you know, because you're so focused, and I know you were participating earlier this week, specifically on the concerns of the folks of color and the diversity and the negative impact of the coronavirus. Can you talk for a minute about that? Because that's a challenge and a concern for many people of how the disparate impact in things that have happened.
Well, as most people know, the deaths associated with the coronavirus are basically affecting people with underlying conditions, and for reasons of health disparity, people of color, Latinos, African Americans, and in some instances Asians, have these underlying conditions and have not been able to avail themselves to adequate health care prior to this. So their diabetes has been unchecked or sporadically checked. The high blood pressure, they're not taking medication, or medication hasn't been prescribed because they haven't been to a physician. Then when you put the coronavirus on top of these underlying conditions, bad things happen. And that's the deaths that we're seeing. Most of the individuals, people with asthma are suffering because the asthma has been unchecked for so long. And this coronavirus has just attached itself to all these underlying conditions, and people are succumbing to this virus in numbers that we never would have anticipated.
So again, let's just dive in that just a little bit, Assemblyman, because again, in your leadership role, and I know there was a joint session, a joint video conference earlier this week where there was testimony and conversation about those disparities. You talked about one of them, which was the health disparities, and we want to make sure to echo again because one of our conversations on our Facebook Live conversations that happen daily, you know, during the week, we had Dr. Renee Garrick, who is the Chief Medical Officer from Westchester Medical Center, WMC Health, and said, hey, if you would have went to the hospital before March, whatever day we did our shutdown, you should go, right? And you should make sure that, as you said, Assemblyman, visit your doctor because your doctor's office are there to make sure that you are healthy and following up on whether it's diabetes, the asthma, or any of the other things that may be high blood pressure, and making sure those things get checked out. You should be in contact with your doctor. Sometimes it's remote now, video conference or FaceTime in or whatever have you, but you need to do that. And I think that's been a big problem. How much can you echo that again, that people should be doing that?
Well, absolutely. Doctors have been seeing people, even if they're not registered patients with them. There are doctors, especially in Yonkers, that I know have been seeing patients and doing tests for COVID-19. Not to any great extent, but it is happening. I think that those who don't have a doctor at this point in time, it's pretty difficult to sign up with a physician. I think those should advocate. We in elective office especially should do everything we can to advocate for our constituents to be associated with a health network. I know here in Mount Vernon, the neighborhood health center sees over 70,000 people a year, which is of course more than the population of the city of Mount Vernon, but those are repeat visits. They will see anyone. So anyone that is feeling ill, I suggest should go to the neighborhood health center in Mount Vernon. And there's also a branch of that health center at 20 South Broadway in Yonkers. That is an available site that will see everyone, whether they have insurance or they don't have insurance. That is, I guess, the health center that people who are suffering under this should be visiting now.
Well, I'm really going to dive just one more second into that because, again, as you just said, for the Mount Vernon Neighborhood Health Center, Judith Watson and the team that's doing a fantastic job there. And again, they have a lot of different support, certainly because of people like you, Assemblyman, making sure that there's dollars and resources that get to the Neighborhood Health Center. There's been some changes in testing, and Mayor Sean Patterson Howard would and you have been advocating to make sure that we can get more testing happening. And now the governor basically opened up that testing earlier this week. Before you needed to be symptomatic. And what it sounds like now, Assemblyman, is almost, and I just wanted to get your thoughts on it. It sounds like if you heard that someone had coronavirus, that you know of this, you have you suspect that you have any one of the symptoms, and those symptoms have expanded to the place that, you know, it's not just shortness of breath, it's not just having a high fever, it's not the cough, the sneezes, etc. It could be sore body, you know, body aches that happen now. Basically, if you have any symptom at all, that you should get tested. And Mount Vernon Neighborhood Health Center is one of those places that you can get those tests, both the diagnostic and I believe the antibody test as well from that 800 number. So we'll talk a little bit more.
Well, as the availability of testing has grown, at first we had to test our frontline workers. That was, you know, first and foremost, because they were exposed constantly, and we wanted to make sure that they were okay. As the availability of testing has grown, now we're going to do what the ultimate goal is to test everyone. If everyone were tested and we could isolate those that test positive, and do the tracing and tracking for people they come in contact with, we can eradicate this virus. But that's not going to happen until everyone has been able to be tested. So I know just yesterday, Montefiore has started doing walk-in antibody testing. So anyone that wants to see whether they've had the virus and it's, you know, transitioned through them without their knowledge, which has happened, they can go to Montefiore, Mount Vernon, and have that test done. I know Grace is also, Grace Church is doing testing. And of course, like you mentioned, the Mount Vernon Neighborhood Health Center is doing testing. So I would suggest that everyone that hasn't been tested, be tested, especially individuals who are living in multifamily dwellings. Like one of the disparities that we talk about, not just health disparities, but there's also housing disparities, where you have families of 3, 4, 5, 6 people living in a 2-room apartment. It's pretty difficult for them to self-quarantine. If someone in a 6-person family comes down with the virus in a 2-bedroom apartment, it's almost impossible for them not to spread it to the other individuals in their house. You know, a lot was made about the governor's brother, you know, Chris Cuomo, who came down with the virus, but he was able to go down to his basement and keep himself away from the rest of his family, and everything was fine. Many people that live in apartments, multifamily dwellings, don't have that luxury. So it's of the utmost importance that all of those individuals be tested. And then if someone in an apartment comes down with it, I do know, I'm not sure about Westchester, but I do know that New York City is providing hotel space for their 2-week quarantine, because many of the hotels have closed down, and places as fancy as the Hilton Hotel in Manhattan are accepting COVID-19 patients for their quarantine. So after we have the individuals, like say, living in a multi-family dwellings tested and someone does test positive, we can't just send them home, and they should be quarantined. And like I said, I'm not sure if we're doing it in Westchester, but I know New York City is doing it. And we could probably get those individuals in. They should be then quarantined for the 2-week period until the virus transitions through their body.
Well, okay, well, thank you for the shameless plug, because your county is absolutely ahead of the game.
Good.
And we've been providing isolation housing, and because it is a function, by the way, that we're required to do. We're not doing it just because we're really nice people, although we are, right? Because the Department of Health is requiring that to happen, and we always remind people. We had that individual that we had to quarantine from Westchester, that we had quarantined somewhere in northern Westchester in one of our facilities because they needed to isolate, and they couldn't isolate at home. So the point you're raising, Assemblyman, is absolutely critical for people to understand when we ask you that question. And I know that they asked this at the Mount Vernon Neighborhood Health Center: can you quarantine at home? If that answer is no, you can't, because you have multiple family members, et cetera, we have some options to do. And it's not necessarily just the spaces that we have available to us. Some of them in hotels, some of them are not, but we have different places that we can have people isolate so that it's successful. And as opposed to what happened in New York initially, unfortunately, we have always had the resources available there to monitor the people, because as you said, you can't just send somebody home and say, good luck in quarantine. Well, what does that mean, right? You know, if you live in a multifamily apartment, well, and you said that everyone should be tested. We were doing testing initially to try to isolate things and contain. Once we went past that, and that's where we are now, we're doing testing to confirm whether someone else is passing the disease around, et cetera. We are able to quarantine people in their home, but provide them support to be able to quarantine at home. And that means everyone in the household gets quarantined, right? In a proactive way. And everyone can and cannot do that. And that's why it's so important to have friends like you, Assemblymen, that help us to connect to those resources at the state level. And fortunately for us, all advocate for the federal level, because the state obviously has a $61 billion budget. At least that's the number, the last number the governor said. We won't be able to get through this without federal resources. None of us will. But the point you're raising, people need to quarantine. When they get the piece of paper, when they go to the Mount Vernon Neighborhood Health Center, we give a document that says, this is what to do, and here's some numbers to call. And I want to ask you, Assemblyman, to remind people to take advantage and call those numbers, because we will provide the support necessary.
Yes, Ken, and I will put those numbers on I do a newsletter, or an email newsletter that goes out 3 times a week. It goes to as many email addresses I could get my hands on in the 89th Assembly District, and I will include those numbers as a matter of course. I think that it's important that people have access to all of the help that they can get.
Okay, and we'll also make sure to send you. We actually created something for multifamily units, for high touch areas, and people should be wearing masks when they're in when they can't socially distance. So we have some of your colleagues that always want to talk about social distancing, and well, they can't social. If you have a mask on, it's because you can't social distance, because you can't be within you can't stay outside of that 6 feet area that's necessary. So wear that mask when you're in a multifamily unit. So if you're in an apartment building, when you get on the elevator, wear that mask, and then make sure to do frequent hand washing. Soap and water is great. It doesn't have to be 180 degrees like my grandmother used to tell me, right? It just needs to be done for 20 seconds, and you can sing your favorite song for 20 seconds, like,
Happy birthday.
Right? Happy birthday twice, Gloria Gaynor, I will survive, whichever ways that you want to do that frequent hand washing, etc. Assemblyman Pretlow, before we go, I want to talk to you about something that I know is near and dear to your heart, because I've been a witness to you advocating so strongly for this. You've been advocating strongly for many, many years with Mount Vernon Hospital and the things with Montefiore and the changes for the people of Mount Vernon and the surrounding areas. Just give us a few thoughts about, what things should be different. I mean, Montefiore from a health system perspective, but specifically for Mount Vernon, what things need to happen.
Well, Montefiore has made it known that their intention is to close the Mount Vernon Hospital. And prior to the pandemic hitting us, they were in the process of shutting down different areas of the hospital, having doctors reassigned some other places, and really decimating the activities in the hospital. When at the beginning of March, the hospital was like limping along, and the governor had made the command that hospitals increase their capacity by 50%, and Montefiore was failing in that. At that time, there were 2 totally empty floors in Mount Vernon Hospital. The ICU section of the hospital was not operational. They even had machines there, but they were not operating. Myself and Senator Bailey and Senator Biaggi wrote a 6-page letter, which I think went public, to the Department of Health, showing how Montefiore was actually hurting the people in the southern Westchester area, Mount Vernon, New Rochelle, that was over capacity at that time. And even in Yonkers, they did start slowly ramping up the activities at the hospital, but still not to make it a full-fledged operating hospital. Because of how this pandemic hit us, it shows why we cannot allow healthcare systems, because they want to make more money, close down existing hospitals that served people in a community for, in this case, over 100 years, because they're putting profits before patients. I think that is unconscionable that they should even think about closing that hospital and replacing it with where they want to do an urgent care center. The last thing this city needs is another urgent care center. There are 3 of them already, and when someone presents with a stroke or with a heart attack, and they first go to an urgent care center to be looked at and then transferred to a hospital in New Rochelle or Yonkers or White Plains, in most cases, they're not going to survive that, especially when there is a hospital that's it's in the geometric center of the city, accessible from all areas of the city. And so I'm still fighting to keep that hospital open. After this pandemic is over, I know Montefiore is going to, go back to attempting to shut it down. I'm going to do everything that I can, and I know my colleagues in the legislature and even in city government are going to join, and we're going to fight to keep that hospital open and operating. And this situation shows just why that hospital was so important.
Well, Assemblyman, thank you so much, and we know you're passionate about this. I just said to the folks when we were just talking now how cool and calm you are, but I will tell you, the folks that are watching, that your advocacy is extremely passionate on making sure that the services that could be provided, and we're all looking that says, well, what does that kind of service mean? Is it a word called hospital, or is it making sure, as you said, the appropriate services can be delivered? It's well beyond an emergency room / urgent care, right? And it may not be what we think of what a hospital is, but it's definitely something more than what they were planning on, and that's going to look for your advocacy and making sure that happens.
So, yes, absolutely.
I mean, anything else you want to bring to the folks as we close up?
Yeah, two things: the census. Everyone has to be counted. Hundreds of millions of dollars are at stake here. My community in Yonkers and Mount Vernon have been lax in reporting. I know we have other things on our minds, but this will affect the communities for the next 10 years. So what we have to do is, if you got it's been extended, go online, do it by mail, whatever you have to do. Make sure that you and your family and everyone living in your home is counted in the census, because we need it.
How long does it take? How is something, because some people, they're like, oh my God, it's gonna take forever. You could do it on your phone, right?
There are 10 questions, and if it takes you a minute to do it, you're not doing well. There are 10 questions. You can go through them in next to no time.
All right. So while they were watching, at the last dance, when they went to the commercial break, they could have done their census. So make
Absolutely.
Sure, right? He said, yeah, one last thing.
And one last thing, I have made available some hand sanitizer. I'm going to be distributing it probably starting next week, more than likely outside of 6 Gramerton Avenue. People should bring their own containers. I don't have containers. I just have gallons of hand sanitizer. And I'll be giving people up to 4 ounces each. And we have rubber gloves if we have them. But, we should all be wearing masks. I'm an advocate of wearing a mask all the time. If you're outside your home, you should be wearing a mask, whether you're 6 feet from someone or 6 inches from someone. Everyone should wear a mask and make everyone else feel safe.
Well, and again, especially a place like Mount Vernon, again, urban, got my mask right here, right? That if you're in an urban area, and that you're going to walk past somebody. This is not walking in the woods. We certainly have places like Wilson Woods where you may not see anyone. You don't need to have a mask on if you're by yourself. However, if you know you're going to pass somebody, you're going to be downtown, you're going to be on Gramerton Avenue, getting ready to pick up some hand sanitizer, make sure you have that mask on and make sure you're wearing it right. Because Assemblyman, I got to tell you, we were in Mount Vernon and some folks weren't wearing it right. Under your chin is not really working.
No.
Is not working as well. So again, Assemblyman James Gary Pretlow, a great friend of mine for a very, very long time, but one of the dynamic leaders for us here in Westchester County in the state of New York. Continued good health, Assemblyman. And again, what day is that going to happen again with the hand sanitizer?
It'll probably happen the middle of next week. I'll put an announcement out on one of my blasts.
And on that post and on his website to do that, and he's going to get those other numbers out to you. Again, thank you everyone for watching our Facebook Live with Assemblyman James Gary Pretlow, the Dean of the Westchester delegation for our state delegation, our state legislative delegation. Thanks again for him to be there. Everyone continue to stay safe and stay healthy. And again, enjoy the days, but make sure that we're all staying safe. Thanks again.
Thank you.